Dr. Maldonado, thank you so much for joining me today. I was really excited to speak with you because you have a very strong background in global health. And so I wanted to ask you specifically about a kind of a trending topic, which is Zika virus. I wanted to know how big data can help us, from a public health perspective, address something like the Zika virus.
That's a great question. So I've been working in the developing world for many years on viral diseases and how we can prevent them. This was an unfortunate opportunity for me. I am excited about it, but at the same time, the impact has been very difficult, especially in pregnant women and their babies. And I was just in Mexico. We're trying to set up a large study there. And in fact, precision medicine, precision health, and big data are going to be really important for us, because what we want to do is understand very simple concepts that we don't know now, which is, how does the virus get from a pregnant woman to her baby? And what are the correlates? So how does that happen? Who does it happen to, and why does it happen? And when we can get a hold of viruses and blood samples and look at the immune responses and the viruses, we can use big data in small numbers of patients to really understand who are the babies who get affected and who are the babies who don't. There's got to be some fundamental genetic reason, either in the host or the virus or both, and environmental factors. But with big data, you can take lots and lots of information and get this 20,000 foot level understanding of transmission. And I've done this kind of work already in HIV. So I worked in sub-Saharan Africa for many years on prevention of mother-to-child transmission of HIV. So I feel like the same principles apply now, but we have hopefully a simpler virus and more big data access so that we can answer this question more quickly.
But we don't even have a way to tell who's been infected with the Zika virus at this point, do we?
Well, we have some ways. They're not great ways, but I think we're going to develop some really cool opportunities, some cool platforms to be able to detect infection in a pregnant woman. And then also to look at past infection, which won't be as easy. It'll be a little more expensive.
How close are we to this?
Well, if we get our way and we can write this grant up that we're proposing, we should be able to start studying by the beginning of the year or sooner, and really start having some answers within a year or so.
Okay. Tell me a little bit about your work with vaccines.
Yeah, so that's always been my passion. I felt like as a pediatrician, you can prevent a lot of disease. Now, these are diseases that don't get a lot of attention because finding nothing is very hard to prove, right? So that you prevented something is very hard to show. Look, we don't have this disease or that.
You can show eradication of disease.
Yes, you
like
can.
We did with polio in most parts of the world.
And so I started working with rotavirus many, many years ago when I was at Johns Hopkins, and we developed a prototype vaccine, a very similar vaccine of which is now on the market. And we think that if we could eliminate rotavirus disease, we would eliminate this, one of the single most important causes of death in children.
Right.
So then I started working with polio because the eradication process had started, and I really wanted to understand the epidemiology of the virus, because you need to understand how the virus circulates through populations, what does immunity do, so that we can prevent further cases. And so I'm still doing that kind of work, and we're hoping to get better information about how to really get eradication done within the next 5 to 10 years or so, hopefully
That would be a wonderful goal.
And then finally, I'm also working with measles. And again, there's a theme here. The viruses that I've worked with are generally viruses that can be at least suppressed significantly or potentially eradicated.
Well, but people need to vaccinate, right?
Absolutely. We really need to get the doubters. And I think that's a natural fear.
Sure.
Because what we see is that people don't see the disease anymore because we've been successful. And they think these diseases are no longer around. But in fact, as we saw with the Disneyland outbreak,
very close to here.
As soon as you reach a threshold of non-vaccination, you can get lots of disease. So we need to keep people aware that these diseases are not quite gone yet. We're almost there, but not quite.
Well, someone with pediatric training, I could not agree more. Thank you so much for everything you're doing, and thank you for joining me today.
Oh, it's been a pleasure. Thank you.